Most people believe that managing high blood pressure comes down to one simple equation. Eat less salt, take your medication, and move on with your life. I spent years watching patients arrive at that conclusion, and I spent years watching it fall short. After more than 3 decades working in cardiac medicine, I have seen the inside of arteries in ways that most people never will. I have seen the scarring, the stiffening, the way a heart quietly compensates and strains, and eventually struggles long before a single alarm goes off on a monitor. And what I can tell you with absolute certainty is that the picture is far more complicated and far more hopeful than the salt and pill story suggests. Let me be clear from the beginning. Medication matters. I am not standing here asking anyone to abandon their prescriptions or to second-guess the physician who wrote them. Medication saves lives. I have seen it do exactly that. But medication, taken alone, often addresses only one part of a problem that has many moving parts. And the other parts, the underlying mechanisms that drive blood pressure up in the first place, rarely get discussed during a standard appointment. Not because doctors do not care, but because a 10-minute consultation simply does not leave room for the depth this subject deserves. That is the gap I want to fill today. I want to walk you through 5 natural compounds, each one targeting a completely different mechanism inside your cardiovascular system, each one backed by genuine research, and each one capable of doing something that most medications alone simply cannot do. Before we get into them, let me give you a little context about who this matters to most. High blood pressure has been a feature of human health for a long time, but it became something closer to an epidemic as modern life evolved, and particularly for adults in their 60s and beyond. Right now, close to 3 out of every 4 adults over 60 live with elevated blood pressure. That is not a minority. That is the majority of people in that age group. And the medications commonly prescribed for it, whether they slow the heart, block certain chemical pathways, or reduce fluid volume, do a real and important job. But here is what they generally do not do. They do not replace what the body has lost over time. They do not calm the chronic inflammation burning quietly inside arterial walls. They do not restore the cellular energy that an aging heart muscle increasingly struggles to generate. They manage the numbers on the monitor. They do not always repair the machinery producing those numbers. Think of it this way. If high blood pressure is a roof with a slow leak, medication places a bucket underneath the drip to catch the water before it causes visible damage. What these 5 compounds do is something different. They help you find the hole in the roof and patch it from the inside. The first compound I want to talk about is one that gets mentioned frequently, but rarely explained properly, and that is magnesium. Not in a vague, general way, but in a way that actually explains what it does at the cellular level and why its absence is such a widespread and largely invisible problem. Magnesium functions inside the body as a natural calcium channel blocker. If you're on blood pressure medication, you may have heard that term before. Calcium channel blockers are an entire category of prescription drugs. Their job is to prevent calcium from flooding into the smooth muscle cells that line your arterial walls, because when calcium rushes in, those walls contract, tighten, and constrict. Blood has to push harder to get through. Magnesium works through a similar mechanism. It signals those arterial walls to relax, to soften, to open up, and allow blood to move with less resistance. That is not a minor function. That is one of the most fundamental regulators of vascular tone in the entire body. Here is where the problem begins. Research suggests that somewhere between half and 2/3 of adults over 60 are running low on magnesium, and the vast majority of them have no idea. The reason they do not know is that standard blood panels do not reliably detect it. Less than 1% of the body's total magnesium supply circulates in the bloodstream. The rest is stored inside cells and bones. So your lab results return looking perfectly acceptable while your arterial walls are quietly starving for the mineral they need to stay relaxed. This is the kind of deficiency that hides in plain sight for years. Now, when it comes to choosing a form of magnesium, the distinction matters more than most people realize. The version you find in the cheapest supplements on pharmacy shelves, magnesium oxide, is absorbed poorly by the body and is most likely to produce digestive discomfort without delivering meaningful benefit. A far better option is magnesium glycinate, which is bound to the amino acid glycine. It absorbs efficiently, it is gentle on the digestive system, and glycine itself carries a mild calming effect on the nervous system, which offers an additional benefit for anyone whose blood pressure is partly driven by chronic stress. For most adults, starting with a modest dose in the evening makes sense, as magnesium supports the cellular repair processes the body carries out during sleep. As always, the conversation with your doctor needs to happen first, particularly if kidney function is any kind of concern. The second compound surprises many people when I raise it, and that is high-quality omega-3 fish oil. Most adults have heard that fish oil is good for the heart in some loosely understood, general kind of way. But I want you to understand the specific mechanism, because once you do, the logic becomes impossible to ignore. Your arteries are not simply hollow tubes carrying blood from one place to another. They are living tissue, and like all living tissue, they can become inflamed. Chronic, low-grade inflammation inside arterial walls makes those walls stiffer, thicker, and less elastic. And rigid, inflamed arteries resist blood flow, which drives pressure upward. This is not a secondary effect or a side note. This is one of the primary drivers of age-related hypertension, and it is one that standard blood pressure medication barely touches. Omega-3 fatty acids, specifically the two active compounds known as EPA and DHA found in fish oil, are among the most thoroughly studied anti-inflammatory agents available without a prescription. Decades of clinical research demonstrate that they reduce inflammation inside vessel walls, restore elasticity to stiffen arteries, and produce measurable reductions in blood pressure, particularly in that upper number that tends to climb as the years go by. A large analysis reviewing the findings of dozens of clinical trials confirmed consistent, meaningful blood pressure reductions in adults with hypertension who supplemented with omega-3s. That is not one study or two. That is a body of evidence built over many years pointing in the same direction. Quality is everything here, and I want to be direct about that. Fish oil that has been sitting in a warm storage environment for months, or that comes from unreliable sources, can become oxidized. Rancid oil does not reduce inflammation. It may actually contribute to it, which is precisely the opposite of what you are trying to achieve. Look for products that are third-party tested for purity and freshness, stored properly, and contain at least 1 gram of combined EPA and DHA per serving. If the capsule smells unpleasant when you open it, that is your answer. Your arterial walls deserve better than oxidized oil. The third compound is one that I take personally and recommend specifically to any patient of mine who is on cholesterol-lowering medication. That compound is coenzyme Q10, and its role inside the body is something I consider genuinely critical to understand. Every cell in your body contains structures called mitochondria, tiny engines responsible for converting the nutrients you consume into usable energy. Coenzyme Q10 is an essential component of that conversion process. Without adequate levels of it, cells cannot generate energy efficiently. They slow down, they strain, they underperform. Now consider this. Your heart contracts and relaxes roughly 100,000 times in a single day. That extraordinary, ceaseless demand for energy requires a continuous and generous supply of coenzyme Q10. When levels drop, the heart has to work harder to sustain its output. And a heart working harder under metabolic strain is a heart contributing to elevated pressure throughout the entire circulatory system. Here is the part one want every adult taking a statin to pay close attention to. Statin medications, which are among the most commonly prescribed drugs for adults over 60 worldwide, work by blocking a specific biological pathway in the liver. That same pathway is also responsible for producing coenzyme Q10, which means that statins, prescribed to protect the heart, simultaneously reduce the body's ability to produce the fuel that the heart depends on. This is not a fringe concern or a theoretical risk. It is a documented, well-understood consequence of how statins work. Beyond medication-related depletion, coenzyme Q10 production naturally declines with age regardless. By the time most people reach 60, The body produces significantly less of it than it did 3 decades earlier. The combination of age-related decline and statin-related depletion can leave cardiac cells running on a fraction of the energy they need to function at their best. Research published in peer-reviewed cardiology literature has demonstrated that coenzyme Q10 supplementation improves heart function in patients with cardiovascular disease and has produced reductions in systolic blood pressure that rival the effect of some pharmaceutical agents in certain studies. Because it is fat-soluble, it should be taken with a meal that contains some dietary fat to maximize absorption. Results build gradually over time, so commit to at least 8 weeks of consistent use before drawing conclusions. The fourth compound is one that most people severely underestimate, largely because of what it is called. Vitamin D is technically classified as a vitamin, but that label is misleading. It functions in the body as a hormone, and like all hormones, it regulates systems far beyond the one most people associate it with. One of the critical systems it governs involves the hormonal cascade that controls blood pressure at a fundamental level. Without going too deeply into the biochemistry, there's a system in the body responsible for managing fluid retention and arterial tension. When vitamin D levels are healthy and adequate, this system operates in a balanced, well-regulated way. When vitamin D is deficient, that same system can become overactive, and the result is elevated blood pressure driven from the inside out by hormonal imbalance rather than any external factor. The research connecting low vitamin D to hypertension is not limited to a handful of small studies. Analyses involving hundreds of thousands of participants have found a consistent, direct association between deficient vitamin D levels and elevated blood pressure. This is biology, not coincidence. And the reason it matters so much for adults over 60 specifically is that this age group is disproportionately affected by deficiency. Aging skin becomes less efficient at synthesizing vitamin D from sun exposure. Many older adults spend less time outdoors than they once did, and food sources alone simply cannot bridge the gap. Estimates suggest that somewhere between 40 and 80% of adults in this age group are either deficient or insufficient, which is a number so large it almost loses its impact. Almost. Before supplementing, get your blood levels measured. A straightforward blood test will tell you exactly where you stand and guide the appropriate dose. The form that matters is vitamin D3, not D2, and it works most effectively when paired with vitamin K2. These two compounds function as partners. Vitamin D supports calcium absorption, and vitamin K2 directs that calcium to where it belongs, into the bones, rather than allowing it to accumulate in the arterial walls where it causes harm. That pairing is worth remembering every time you reach for the bottle. The fifth and final compound brings us back to something that many people think they already understand, which is the relationship between salt and blood pressure. Most adults know that sodium raises blood pressure. That is common knowledge. What is far less commonly understood is that sodium does not act in isolation inside the body. It has a direct counterpart, and that counterpart is potassium. The two minerals are engaged in a constant physiological negotiation inside the kidneys. Sodium signals the kidneys to hold onto fluid, which increases the volume of blood circulating through the vessels and pushes pressure upward. Potassium signals the kidneys to do the opposite, to release sodium and draw excess fluid out of the body. They are, in the most literal biochemical sense, on opposing sides of the same equation. In adults eating a modern diet, that equation is heavily tilted. Sodium intake tends to be high. Potassium intake tends to be low, and the kidneys respond accordingly, holding more fluid, raising pressure, and compounding the problem that medication is then prescribed to manage. Research consistently demonstrates that raising potassium intake produces real, measurable reductions in blood pressure, especially in adults who are already sensitive to sodium, a description that fits a large proportion of people over 60. The effect is most powerful when both sides of the equation are addressed at once, reducing sodium while simultaneously increasing potassium. I want to be very direct about one thing here, more so than with any of the other 4 compounds we have discussed. Potassium supplementation requires medical supervision. Unlike magnesium or coenzyme Q10, excess potassium in the bloodstream can be dangerous if the kidneys are not functioning well enough to clear it efficiently. The result can be a condition that causes serious disruptions to heart rhythm, and that is not a risk to take casually. For most people, the wiser approach is to pursue potassium through food first: sweet potatoes, avocados, leafy greens, legumes, fish. Let your diet do the work. If supplementation is something you and your doctor decide to pursue, let that conversation happen with current kidney function data in hand. Now I want you to sit with something that I believe is the most important idea in everything I have shared today. Each of these 5 compounds, taken individually, produces a modest but real effect on blood pressure. A few points here, a few points there. Meaningful, but not dramatic on its own. But here's what that framing misses. Blood pressure is not the product of a single mechanism. It is the result of multiple systems operating simultaneously: vascular tension, arterial inflammation, cardiac energy output, hormonal signaling, fluid balance. When you address only one of those systems, you move the needle a little. When you address all 5 at the same time, something more significant begins to happen. Magnesium relaxing the arterial walls. Omega-3s calming the inflammation, stiffening those same walls. Coenzyme Q10 restoring the energy efficiency of the heart, driving blood through them. Vitamin D regulating the hormonal system, governing pressure from within. Potassium rebalancing the fluid equation the kidneys manage every moment of every day. The combined effect of working on all 5 fronts simultaneously can be considerably greater than any single intervention alone. This is the conversation I have with patients who come to me frustrated that their medication is not doing enough, or who want to understand why their numbers remain stubbornly elevated despite doing what they were told. It is not a simple conversation, and it does not produce overnight results. But it is an honest one. And honesty, after 30 years in this field, is the thing I value most. Before anything else, I want to make one point absolutely clear. Natural does not mean harmless. Every compound I have described today carries considerations that matter: interactions with medications, contraindications for certain health conditions, dosing thresholds that should not be exceeded without monitoring. High-dose omega-3s can affect blood clotting, which is relevant for anyone on blood thinners. Coenzyme Q10 can interact with anticoagulants and may influence blood sugar. Magnesium can accumulate to problematic levels in compromised kidneys. Vitamin D taken without monitoring can reach levels that cause harm. And potassium, as I described, carries real cardiac risk in the wrong circumstances. None of this means these compounds are dangerous for most people at appropriate doses. For the majority of healthy adults, they are well tolerated and genuinely beneficial. But most adults over 60 are not taking 0 medications. Most are navigating several conditions at once. And that is precisely the context in which professional guidance stops being optional. Use what you have learned today as the beginning of a real conversation with your physician. Bring a written list. Ask specific questions. Request the blood test that would tell you where your actual levels stand before you make any decisions. That is not excessive caution. That is how information becomes genuinely useful. Here is what has stayed with me through more than 30 years of cardiac practice. High blood pressure in an older adult is not simply a plumbing problem to be managed with a monthly prescription. It is a signal. It is the body's way of communicating that multiple systems have been under quiet strain for a long time, probably far longer than the elevated number on the monitor suggests. Medication can suppress that signal, and suppressing it is valuable because it reduces immediate risk. But the signal itself, the underlying strain generating it, does not disappear simply because the number on the screen has been brought into an acceptable range. The gap between managed numbers and genuine cardiovascular resilience is real, and it is exactly the space these 5 compounds are designed to help close. I have sat across from patients who were told, sometimes quite kindly and sometimes with less care than they deserved, that elevated blood pressure was simply an inevitable feature of growing older, something to be managed indefinitely, not something to be meaningfully addressed. And I have watched some of those same patients given the right nutritional support and proper medical oversight, achieve readings they had not seen in 20 years. Not everyone reaches that outcome. I will not promise something I cannot guarantee, but enough do. Enough have. Enough that I stopped accepting inevitability as a complete medical answer a long time ago. Your cardiovascular system, even now, even at whatever age you're reading this, retains a remarkable capacity to respond to what you give it. The question worth sitting with tonight is simply this: are you giving it what it actually needs?